Good evening. I'm Susan Ward. I'm a nationally board certified health and wellness coach and lifestyle coach for the CDC Diabetes Prevention Program. I'm here tonight in my capacity as a Family Heart Foundation ambassador. And tonight we are having our May meeting of Empower LP(a) for all of you who have elevated lipoprotein(a) and have questions about nutritional strategies for managing elevated lipoprotein(a). And we're going to have tonight evidence-informed approaches to heart health. And our featured speaker is Family Heart Ambassador Heather Shasa, Master of Science, registered dietitian, nutritionist, and certified clinical lipid specialist. First, I'd like to thank our sponsors. The Family Heart Foundation gratefully acknowledges the generous support of our corporate sponsors for the 2025 Lipoprotein(a) Community Activation Program and LPA Awareness Day campaign. And those sponsors are Lilly and Novartis. Our medical disclaimer. Today's program is for your informational and educational purposes. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment, nor does your participation constitute a medical or coaching relationship with the presenters or employees or officers of the Family Heart Foundation. Future research may impact today's presentation. Information may be updated or changed in subsequent presentations. Please follow up with your medical professional for specific recommendations pertaining to your or your family member's diagnosis or treatment. And if you have questions, please reach out to a Family Heart Foundation care navigation specialist for further resources. The link to the Care Navigation Center is on the Family Heart Foundation website. And I just want to say that tonight I also have with me our co-host, Jen Farnell, who is our community manager. She does all the linking to everything that's out there with the ambassadors, the training for the ambassadors, the training and subsequent presentations that people do at different health fairs and other locations. She is out there in the community. And I want to say that the team at Family Heart is so awesome. They do the most amazing work. They work so hard for all of us. They really do. I am just, every time we get together for an ambassador meeting or any other meetings, I am always impressed with the quality and the care that this foundation has for its members and its outreach. So tonight, our featured speaker is another Family Heart ambassador, and Heather Shasa is a founder and owner of Welding Wellness, LLC, providing virtual nutritional counseling services, and she specializes in lifestyle strategies for high cholesterol, high triglycerides, and lipid disorders. She's also a creator and curator of information and content for the Heart Health League, a community-powered learning experience. Previously, she was employed as a registered dietitian with the Kessler Institute of Rehabilitation, St. Clair's Hospital Health Services, and the Center for Orthopedics in New Jersey. She holds a Master of Science in Nutritional Science from St. Elizabeth's University and a Bachelor of Science from Rutgers University. She is also a certified clinical lipid specialist, accreditation from the Council for Clinical Lipidology, the American Board of Clinical Lipidology. In addition, she holds certificates of training in adult weight management and sports nutrition and wellness certificate. It is my great pleasure to introduce to you our guest speaker, Heather Shasa.
Thank you so much, Susan. And thank you everybody for attending tonight. I'm so excited to be able to share a little bit more about nutrition with all of you. And I am going to share my screen in just a minute. So please bear with me. And as we get started today, again, before I share my screen, I wanted to let you know again that I myself have familial hypercholesterolemia, which is again a genetic disorder as well. And why I'm so passionate is because my dad passed away at the age of 47 after suffering heart disease. So this is just as personal as it is professionally. So I'm so excited again to be a part of your journey and learning a little bit more tonight. And hi, everybody, as you're tuning in. So I'm going to share my screen and present so that way you can see my full screen. So tonight we're going to be discussing nutritional strategies for managing elevated Lp(a). So as Susan had mentioned, we talking about introduction, just a little disclaimer that this presentation is meant to provide general nutritional considerations only and is not a substitute for medical advice. So please consult your healthcare team for individualized recommendations and further support. So our key points that we're going to discuss tonight is understanding a little bit more about Lp(a), nutrition's role in heart risk reduction, strategies for a heart smart eating plan, emerging therapies, as well as resources and support as you embark on your journey towards heart healthy living. So what is lipoprotein(a)? And this image is courtesy of the Family Heart Foundation. So Lp(a) is similar in structure to low density lipoprotein, or LDL. It consists of an LDL particle that contains apolipoprotein B, ApoB100, in fact, and it's connected to an additional protein called apolipoprotein a. So approximately 90% of our plasma Lpa levels are genetically determined. Elevated Lp(a) is associated with an increased risk of atherosclerosis, heart attack, and stroke. And so Lp(a) levels greater than 50 milligrams per deciliter or 100 nanomoles per liter are considered to be high. So what do we want to know about Lp(a)? It can have almost a trifecta impact. So it can be pro-inflammatory because this contains oxidized phospholipids that can play a role in increasing the risk of plaque rupture and the start of atherosclerosis. It can act almost like pro-atherosclerotic, meaning it may cause plaque buildup and the narrowing of the arteries, and it can increase the risk of calcification and aortic valve stenosis. And lastly, it can be prothrombotic. It can compete with a similar protein called plasminogen, which can make it difficult for blood clots to break down. And so when we look at some different strategies, when it comes to nutrition, unfortunately, when it comes to diet and lifestyle, it only produces a modest impact, meaning that there are some studies that show that diet maybe have an impact. As far as whether or not it's clinically significant is yet to be determined. But why it's so important and why nutrition still matters is because we want to lower all of our risk factors when it comes to cardiovascular disease. So not only just focusing on elevated lipoprotein(a), but also other risk factors that we might be experiencing. So it may help in lowering our LDL cholesterol, in addition to other lipids or lipoproteins, which may impact your risk, such as triglycerides, apolipoprotein. It might also help with lowering blood pressure and inflammation. And so nutrition can play a role in managing these modifiable risk factors. And it also can build a sense of agency and control, meaning that it helps us to really focus on factors that are foundational, including nutrition and lifestyle management, to really still make an impact on our cardiovascular risk. So when we nutrition prescription, there's different factors that are going to affect it. And this, some of the things that we want to consider when we think about what type of dietary pattern is going to be best for us are some of these factors I have listed here. So we want to take a look at your own medical history. In addition to elevated LP little a, are there additional lipid disorders or elevations in lipids? Do you have other cardiometabolic conditions, a history of hypothyroidism or kidney disease, menopause? All of these things we want to consider. Do we have a family history, again, of early cardiac events or family history of other cardiometabolic conditions? Additional pertinent information could be what medications were currently prescribed that might be causing drug and nutrient interactions that we would want to take a look into to create your nutrition plan, and also what your current dietary pattern is. I also want you to consider your access to food and neighborhood and your living environment. Again, cost of food and groceries can play a role, along with where you live in your neighborhood. Do you live in an urban or rural neighborhood? What are your living arrangements? Do you live with family or friends or whatever that family dynamic looks like? Grocery stores accessibility can all play a role, and also your access to resources in healthcare. So, looking at developing this nutrition plan, whether we can use and rely on maybe these additional sources such as physicians and lipidologists and ancillary healthcare, looking at blood work and genetic testing if warranted, medications, again, financial impact, and also our education resources and programmings, online versus in person. All of this can play a role, again, into the dietary pattern. And so the bottom line that I want you to take away is make a plan with the resources you currently have and have access to as a foundation for creating your heart healthy dietary pattern. So, where you are right now can be a great starting point to help you really move the needle forward on creating cardioprotective nutrition and lifestyle strategies. So when we think about the goals of a heart smart eating plan, we really want to focus on lowering our LDL cholesterol and those additional atherogenic particles. We can also focus on reducing systemic inflammation, support healthy endothelial function, which means, again, keeping those arteries nice and clear and clean, maintaining blood pressure and blood sugar levels, and also promoting overall heart resilience. So when we think about nutrition for LP little a, there are some pillars that can provide a foundation, an essential foundation to help at least reduce those risk factors for cardiovascular disease. We can look at the quality of fats that we're choosing, focusing on unsaturated sources of fat, fiber-rich foods that are going to help support your gut and lipid health, anti-inflammatory choices. We can add in whole plant foods, herbs, and spices, and also, again, sodium and sugar awareness. How can we reduce some of these added and hidden sources? So these are just some key pillars that we can use as a foundation to start to build our heart healthy treatment plan. So when it comes to fat quality, I want you to consider some things. And the reason why I bring this up is because I know that there can be a lot of confusion. And so when we look at the different types of fat, we want to look at the sources of where it's coming from, what it's being replaced with, and what we're choosing. So, for example, let's say, again, we're looking at saturated fat. So saturated fat can come in a variety of different sources, such as your sausage or fried foods, your chicken, your dairy products, and even your nuts and seeds. But if we look at saturated fat and replace it with polyunsaturated fat, this might help to reduce our LDL cholesterol levels and also provide a reduction in cardiovascular disease. So I highlighted two studies that show this. So there is most of the available evidence suggests that replacement of saturated fatty acids with sometimes carbohydrate or unsaturated fat might modestly increase LP little a, while consistently decreasing LDL cholesterol. Although the results of a few trials deviate from this and suggest replacement of saturated fatty acids with unsaturated fat from particular food sources such as nuts may not increase LDL to that same extent. So what this is really summarizing is that yes, certain nutrients that replace saturated fat might cause a modest increase in LP little a, but it really also depends on where that source is coming from. So if we look at the second line, the second paragraph, is an individual's at risk of CVD, replacement of saturated fatty acids with unsaturated fats from walnuts or vegetables have more of an improved lipid and lipoprotein impact, including LDL cholesterol, non-HDL cholesterol, and total cholesterol without an increase in LP(a). So the bottom line is looking at what we're choosing and what we're replacing with to help us truly lower our risk factors. So I want to highlight some things too to give you some more context into this. So you might have heard of omega-3s and omega-6s. And why do we usually incorporate them into a heart-healthy dietary pattern? Because if we look at polyunsaturated and monounsaturated, replacing them in place of saturated fat can actually help to lower our LDL cholesterol levels. So if we look at omega-3s, these, known as EPA and DHA, which you might be familiar with, are found primarily in fish and seafood, but they can also be found in chia seeds, flax seeds, pumpkin seeds. If we look at some of our omega-6 polyunsaturated fats, we can find these in our walnuts, tofu, our sunflower seeds, and also our monounsaturated fats, with the biggest component being oleic acid, can be found in sources such as your avocados, olive oils, nuts, and seeds. Well, this is a little bit of a more encompassing slide, but I wanted to show you because I know in my practice, I have clients that ask a lot of questions about unsaturated fats and different forms of saturated fat. So I wanted to show you its impact. Okay, so if we look at different forms of saturated fat on the left-hand side, we see that we have short chain, medium chain, long chain, and very long chain fatty acids. And so where we start to see potentially an increase in our lipid levels is with more of the medium chain and long chain fatty acids. So if you look on the right-hand side, there's also this graphic to show you the distribution of common foods and their fatty acid composition. So if you look at the top half of the screen, you'll see that some of your solid fats like coconut oil, palm kernel oil, they're going to be highest in saturated fat. Whereas if you look at the lower end of oils, your canola oil, safflower oil has lower saturated fat and more fat coming from our monounsaturated and polyunsaturated. So we want to choose more heart-supporting fat to help guide us. So we can choose more extra virgin olive oil, fatty fish, nuts, and seeds in place of foods that might be higher in saturated fat, particularly those sources that we're finding in butter, coconut oil, or lard, in some of our processed meats, fried foods, and our packaged snacks. The next thing that we can do to start to create a cardioprotective pattern is to boost fiber, particularly soluble fiber. So there's two different types of fiber that we can think about. Insoluble fiber, which this fiber doesn't dissolve in water and therefore relatively passes through the intestines undigested. Soluble fiber, known as viscous fiber, dissolves in water and helps form a gel-like substance in your intestines. So soluble fiber includes plant pectin and gums, and it can help reduce LDL by binding bile acids and reducing cholesterol absorption. So where do we find soluble fiber? Particularly in our oats, barley, lentils, beans, apples, pears, and ground flaxseed. So insoluble and soluble fiber are both important into creating a heart-healthy dietary pattern. And particularly soluble fiber may edge out insoluble fiber, but both fibers are important to incorporate. The next thing that we can look at is also reducing sodium intake. So the reason why I highlight this too is because we tend to have a lot of foods that are higher in sodium. And when we look at a cardioprotective pattern, we want to focus on maintaining healthy blood pressure levels. And so if we look at where most sodium consumed comes from, is in our process at our restaurant food. So it's not just what we're adding to this from the salt shaker, it's what's also in our foods. So top 10 sources of sodium include our breads and rolls, pizza, sandwiches, cold cuts, soups, burritos, our sauces, our gravies as well, and even in our savory snacks like your chips, popcorn, and pretzels. So by choosing alternatives that are lower sodium, or maybe seasoning our foods with herbs and spices, can also be ways to help to reduce the amount of sodium that we're getting from our diet to help maintain those healthy blood pressure. Also, we can reduce added sugar. So if we look at the left-hand side, the American Heart Association recommends no more than 6 teaspoons of added sugar for women and children, and no more than 9 teaspoons of added sugar for men. And to kind of show you that comparison, I just took some different beverages that you might find. So if we look at a 12 fluid ounce soda, that can have about 9 3/4 teaspoons of added sugar. A lemon iced tea. This could be for different types of iced tea, 11 teaspoons of added sugar. If we look at a pumpkin spice latte, 16 fluid ounces might have around 12.5 teaspoons of sugar. And again, a medium chocolate milkshake up to 24 teaspoons. So what we can do with some of these options is maybe lighten them up by maybe choosing an unsweetened iced tea, or maybe choosing a smaller portion size instead of a larger portion size to help us to lessen the amount of added sugar, to also help to be part of an overall heart healthy dietary pattern. Now, when we think about anti-inflammatory eating, there's some foods that might be beneficial. And again, we know when we look at dietary implications that, again, there's not going to be one direct, unfortunately, way to lower LP little a through diet. However, what we can do again is look at these foods from an overall perspective that might be beneficial for lowering risk. So if we look at anti-inflammatory eating, some foods might have those additional benefits. So if we look at omega-3 rich foods, we're looking at sources of fish, salmon, herring, flax seeds, walnuts. Also, what's interesting is your deeply colored fruits and vegetables. So eating from the colors of the rainbow can be very beneficial, particularly from your reds and greens, and your yellows and blues can really be impactful. So some sources include your blueberries, raspberries, cherries, beets, or dark green leafy vegetables, and our cruciferous vegetables such as broccoli, cauliflower, cabbage. Also, your herbs and spices. So we can look at turmeric, ginger, garlic. And so turmeric has a compound curcumin that might sometimes inhibit inflammatory signaling pathways and reduce inflammatory markers, while other studies have shown no effect or inconsistent effects in humans. So, what I would suggest too is looking at coming from a food first approach. How can we maybe add these herbs and spices into your cooking or your meals as a way to reap some of those health benefits from a perspective that is achievable, doable, adds flavor, and can be cardioprotective? And the last one is green tea and also cacao, which is known as your dark chocolate. So it can be a source of phytonutrients called polyphenols, which can also maybe have some favorable outcomes and favorable ways to help, again, support an anti-inflammatory diet. Again, focusing on a food first approach first, and then looking at ways that maybe we can add these in to create that protection. So when we look at dietary patterns that may modestly impact LP little a, And there's three main ones, which is your plant-based, your Mediterranean diet, and also your dietary approaches to stop hypertension, your DASH diet. And so if we look at these dietary patterns, I'm going to talk about them individually and why they might be overall a cardioprotective dietary pattern. But I also want to point out, because I know that I've been getting a lot of questions as well about this, is what about a lower carbohydrate eating pattern? And again, it's going to be what works best for you. A low carbohydrate dietary pattern may reduce the concentration of Lp(a) by 15%. However, data is insufficient regarding a low carb ketogenic dietary pattern, as risks may outweigh the reduction in Lp(a). So further and longer term controlled clinical trials are needed. And this is why it's so important that we individualize dietary patterns based upon all of your different risk factors. So while this presentation tonight can give you some insight and some guidance, really working one-on-one with your healthcare team can really help to see which levers we need to lower to reduce your risk and how to create a plan that's right for you. So if we look at plant-based dietary pattern, so this is going to emphasize whole food plant-based options such as your fruit, vegetables, whole grains, legumes, your lentils, peas, nuts, and seeds. And for limiting, it's going to, on a vegan dietary pattern, is going to limit animal products. So meat, poultry, eggs, dairy products, and honey. And a vegetarian diet limits animal products as well, but it also depends on what type of vegetarian pattern that you follow. So some individuals might choose to still incorporate dairy or eggs. Others might choose to eliminate that. So understanding what type of dietary pattern that you're following. So the impact on Lp(a) is also promising. That shows that it can reduce Lp(a) by 16% in 4 weeks and lower other risk factors like LDL cholesterol and inflammation. And so looking at these studies, again, most of them are short term. And so we really want to have that opportunity to have further clinical trials that show us more impact and more details. And so what we want to also focus on is that an imbalanced vegan diet can lead to an increased risk in nutrient inadequacies, including protein, iron, vitamin B12, and calcium. So that's where nutrition guidance can help support you to help ensure that you're getting all of these wonderful nutrients by following a whole food plant-based dietary pattern if it's right for you. And also, while we're going through, I know I see some questions coming through, so please continue to ask questions. We will definitely make sure, hopefully, to address as many as we can at the end. The Mediterranean diet is another dietary pattern. And I wanted to highlight this here. This is from Old Ways. It's a really great resource to show you different types of lifestyle and eating patterns from Mediterranean, Asian inspired. And so what this shows us is what a Mediterranean diet emphasizes. So if we look at the bottom portion of the pyramid, it is primarily focused on fruits and vegetables, whole grains. As you travel up the pyramid, it also incorporates seafood and fish, also some poultry, eggs, cheese, and yogurt, and less often is meats and sweets with the occasional glass of wine. And what the Mediterranean dietary pattern limits are red and processed meats, so they're eaten or consumed more occasionally, refined grains and processed foods, added sugars and sweets are also limited. Butter and other saturated fats are often replaced by olive oil in this pattern. Highly processed or fast foods, and also convenience meals that may be higher in sodium or trans fat are also limited. And another thing to note here too is I know that I'm talking primarily about nutritional strategies, but lifestyle strategies are just as important. And so if you look at the bottom of the dietary pyramid of the Mediterranean diet, it also emphasizes social connection and support, which is really important when it comes to overall cardiovascular health. And the next A dietary pattern is dietary approaches to stop hypertension, also known as the DASH diet. So this emphasizes fruits and vegetables again, rich in potassium, fiber, and also those antioxidants. Whole grains. Here's some examples: your brown rice, whole wheat bread, and oats. Low fat or fat free dairy. Lean proteins, your skinless poultry, fish, lean cuts of beef or pork. It also incorporates legumes, nuts, and seeds, and also is mindful of incorporating healthy fats, but in moderation. So, olive oil, avocado, nuts, and is limited to small amounts due to calorie density. Water and unsweetened beverages are also emphasized. The DASH diet limits sodium. So the goal is 2,300 milligrams, or ideally, potentially 1,500 milligrams per day. And again, avoiding high sodium processed and packaged foods. Saturated fat and trans fat sources are also limited. So again, being replaced by those olive oil, avocados, or nuts. So they limit butter, full fat dairy, fried foods, and fatty meats. Added sugar is also limited. Red and processed meats are eaten more occasionally. And alcohol is also limited to 1 drink per day. And in the research that I was also looking at in terms of alcohol, there seems to be no impact from the studies I've seen on LP little a. However, when it comes to alcohol, I would still suggest limiting your intake for overall cardiovascular benefits. So again, making sure that we still are limiting alcohol, because sometimes, again, it can also be mixed with other added sugars or other types of maybe mixers that also can increase in an area that is not providing a lot of nutrition. So again, limiting your alcohol to no more than 1 drink per day for women, or two drinks per day for men. So keeping it on more of a limited intake. So if we look at these different dietary patterns, there's some commonalities in them. So I want to focus on different areas of what they focus on limiting. The first one is trans fat. So trans fat can naturally occur in meat and dairy, but it can also be made through a process called hydrogenation. So partial hydrogenation was removed from our food supply through about removed in like 2018, I believe. And so it full hydrogenation provides less trans fat. However, sources can still be found in baked goods, packaged snack foods, margarines, and crackers. So when we look at trans fat, again, it's still a source of fat that we want to limit or replace with, again, focusing on that replacement nutrient with unsaturated fat sources. If we look at saturated fat, which is limited in these dietary patterns, we're looking at fattier cuts of meat, beef, pork. Our processed meat products, such as bacon or sausage, our fried foods, poultry with the skin, full fat dairy foods, and tropical oils known as your coconut and palm oils. Cholesterol, again, these sources are eggs, cheese, shellfish, organ meats, full fat dairy, and fried foods. Again, still should be in modest intake. If we look at refined carbs, where these are found is in our white flour, white bread products, certain cereals, our breakfast foods, white flour, and white rice. And so when we think about refined carbohydrates, for those who are unfamiliar, and we talk about what's the difference between maybe whole grains, right, and refined grains, whole grains contain all three parts of the grain kernel. And so you get more fiber, you usually get more nutrients, and it's more slowly digested and absorbed. It usually also has more fiber, which is important, again, for not only supporting good gut health, but also lowering your potentially LDL cholesterol. When we look at something like refined carbs, what happens is the outer layer of the grains are stripped away. So you're left with a quicker acting source of sugar and maybe a option that might not have as much nutrition as the first product. So if we look at the dietary patterns, normally they limit these refined carbs or starches. They also limit added sugar. So looking at our sugar-sweetened beverages, desserts, our sauces, our dairy, our desserts, donuts, sweet rolls, and pastries, and also limits sodium. So looking at where those hidden sources of sodium are from and ways to reduce it. Commonalities in dietary patterns, what to include. So our fruits and vegetables. Again, all forms count: fresh, frozen, canned, dried, and 100% juice. But be careful with the added sugars that might come in your canned goods. Again, choosing options that are in 100% juice, and just being mindful with your dried and juice portions, because they can be sometimes a more concentrated source of sugar, particularly for your dried fruits. If we look at, again, whole grains, what can we add in? Oats, barley, quinoa, wild rice. Healthful protein sources can be our legumes and pulses, fish and other seafood, our low-fat dairy products, nuts and seeds, and lean meats. We can also look at legumes. A lot of these dietary patterns have beans, dried peas, and lentils as their basis, and also, again, incorporating nuts and seeds like your almonds, walnuts, sunflower seeds, pumpkin seeds, and flax seeds. So these are some insights. There's different mixed reviews when it comes to these added nutrients. So if we look at current studies and research shows contrasting and mixed findings as to impact of dietary interventions on LP little a. So more research is needed to determine the effects of lipoprotein little a lowering and CVD risk reduction and outcomes. So coenzyme Q10 overall among the trials included in a recent meta-analysis, the degree of plasma Lp(a) reduction after CoQ10 supplementation was significant yet modest. And so there was a greater Lp(a) reduction was observed in patients with increased baseline Lp(a) levels than in patients with lower Lp(a) levels. And so again, this is still mixed reviews whether CoQ10 as a supplementation can be beneficial, but it's something to be worth noting, because as we learn, as we grow, as we study more, and as there are more trials to be done, we can look at some of these factors. If we look at L-carnitine, oral L-carnitine may improve lipoprotein a levels in patients with elevated Lp(a), but we don't know the risk of cardiovascular events in patients with hyperlipidemia is still unknown. So even though if we look at sources of L-carnitine, we find it in your red meat, dairy products, fish, poultry, tofu, and peanut butter, but overall, with this slight reduction, we don't know if it improves cardiovascular outcomes, which is really where we want to see benefits. So again, looking at CoQ10 and L-carnitine, is it something that we might see moving forward? Yes, but it's something that, again, considering, we want to focus on. And it's going to have mixed reviews, and really focusing on a food-first approach is going to be key. So plant sterols and stanols is found in your nuts, seeds, vegetable oils, cereals, legumes, fruit, and fortified foods, and might be a statistically but not clinically significant reduction in our Lp(a) following phytosterol. But again, adding plant sterols and stanols in the forms of nuts and seeds into our diet might be helpful, along with adding in flaxseed, which again, there really wasn't much evidence for it, but it might help to reduce other markers of LDL cholesterol or other atherogenic particles. So choosing milled or ground over whole flaxseed, and also resveratrol as well, which sources include red grapes, or raspberries, mulberries. Only a few small studies have investigated resveratrol's effect on Lp(a), with not many studies showing a definitive effect. So these are just some foods that, again, we can add into our diet as part of an overall dietary pattern. So when it comes to managing LP little a and application and implementation, there's a few things to know. So, what we can do in order to create this overarching diet and lifestyle for you is to gather all of your health information, including your medical and family history and current providers and care team. You can also review your current and dietary lifestyle habits. Which current habits are helping or hindering your progress? Determine your heart healthy dietary pattern based upon your own personal needs and your risk factors, as well as what is most sustainable and realistic for you. Implementation, we can make a plan with the resources you have and have access to serve as that foundation for you. You can always pivot, redirect, and learn as you go. And you can manage your additional risk factors for heart disease, such as lowering your LDL cholesterol, reducing blood pressure or blood sugar, avoiding smoking, increasing physical activity, weight management, and so forth. So, guidance and support. Work with your team to create a game plan that is individualized to you and that you are a central part of. You know you best. And so, bringing together physician, healthcare providers, cardiologists, lipidologists, dietitians as part of your care team can help direct you and support you. And so, by bringing people together, this helps you to understand what your LP little a level is and what that means for you, what medications or therapeutic modalities you may need to assist in lowering your levels, and also ways to create a dietary and lifestyle plan that personalizes nutrition recommendation, meets your nutritional needs, and helps you to create healthier habits that stick. And when we think about support, we have our family and friends as that foundation, but also you might need additional support with the LP little a support group on Facebook, which Susan is so nice to bring us all here together tonight. We also have the Family Heart Foundation, which provides resources about lipoprotein little a, free lipid screening test available in most states. We also have an excellent care navigator that can help be a connector for you. You can also find a specialist, as well as using the National Lipid Association Foundation for further support. You can also have a registered dietitian nutritionist as part of your care team. We are here to help. And here's some ways to get started with searching for an RDN. So you can look at the Academy of Nutrition and Dietetics. You can also call your insurance company to find a dietitian in network. And you can even look at websites like Health Profs and ZocDoc to help to find that resource for you. And insurance coverage for nutrition services vary, but you might have preventative nutrition services and benefits under the Affordable Care Act. So, what that means is potentially nutrition sessions may be covered at 100%, no deductible, no copay, or may just be subject to the deductible or the copay. So it's really great to utilize your insurance benefits to find a dietitian near you, and you might be able to get some nutrition services covered. So what can we do? Turn knowledge into power with a quick recap. So, reducing and managing all of your cardiovascular risk factors will be key. Several studies have observed changes in Lp(a) levels with various diets. However, this impact was universally modest. So, diet has been shown only to modestly influence Lp(a) levels. So, remember, it's about the overall dietary pattern and not just a single nutrient. What is it being replaced with? What is it? What's the source? What's the amount? And also incorporating a dietary pattern that emphasizes whole grains, fruits, vegetables, legumes, nuts, and seeds, and is mindful of trans and saturated fat, cholesterol, refined starches, and added sugar. Work with your healthcare team to develop an action based plan that's right for you, because this helps in your shared decision making, determining what medications and therapeutic modalities will work best for you, determining those target ranges and goals for all of your risk factors, including your blood pressure, blood sugar, and lipid levels. what are your nutrition and lifestyle interventions, and also how to monitor and measure your progress and outcomes. And lastly, what we can do is also take heart. While again, diet might not directly impact little LP little a to the levels we need or want, we can still reduce our cardiovascular risk factors overall. So if we look again overall, take heart, know that it is just a risk factor, and we can start today to make those dietary and lifestyle interventions that are going to be cardioprotective for you. So thank you so much. And I'm going to open it up for questions. And I know that we had some questions come through. And if Susan and Jen also want to come on back into our discussion.
Right. Heather, one quick question. Will there be a downloadable printable brochure? Will you be able to make your slides available in the group?
Absolutely. Whatever I can do to support each and every one of you, yes. So I will make sure to download the slides and give them to you, Susan, to upload into the LP little a support group.
Wonderful. And we know that we are recording this, so the program itself will probably be turned into a YouTube video eventually with the foundation's help. So we will have both the slides and the video. Here's our first question. This is from one of our members. I have been eating whole foods plant-based with no oils. I get my fats from avocado, nuts, and seeds. Would it be beneficial to start adding extra virgin olive oil, salmon, and sardines, or is it better to still not eat those?
That's a great question. And I think it really depends on you in particular, whoever this is. Sardines, if we look at sardines and salmon, they can be a great source of omega-3s. So potentially adding them in and maybe looking at your overall dietary pattern. So if you feel that you want to add them in, certainly they are good sources of unsaturated fats. It really is up to you, but that can be perfectly okay to add into your dietary pattern overall. And another thing too, I know what another question had come through, Susan, about fish, and I believe I added it to the presentation to add in fish, and I thought that these were good resources too to elaborate on that question. So this is from I think it's the National Seafood Partnership. If we're looking at fish, again, we can choose ones that are going to be higher in omega-3s. And so this shows you from left to right which ones are going to be the highest sources. Now, I will say to be aware of things like mackerels and swordfish, which consumed in excess can also increase potentially levels of mercury. So it's still being mindful. However, there's still a good source of omega-3s. And so if we look at the other side too, the Monterey Bay Aquarium Seafood Watch has a consumer guide that discusses sustainable seafood options based upon your region. And I understand that individuals from all over the world may be attending this session tonight, but this, I believe, might just be for the United States, but it gives you at least a good starting point to understand also sustainable seafood options.
No, thank you very much, Heather. I have another question here. Is there any validity to studies that say that fermented dairy, even full fat, doesn't negatively impact blood lipid levels?
That's an interesting area and an interesting question. There are some preliminary studies that might show that it might have a negligible effect, meaning no benefit or not having any worsening of our lipid levels when it comes to dairy products. However, this is where, again, we need more studies, we need more clinical research, but I'm curious to see, especially in the upcoming months, years, how fermented food will continue to play a role in not only gut health, but also its impact on our lipid levels. So yes, there is some truth to that. However, from an overarching perspective right now, still being aware of the types of saturated fat sources we're choosing, and right now still aiming for lower fat dairy products until we have more research.
Okay, so now let's go to low carbohydrate. Low
Mhm.
carbohydrate, low animal protein is a challenge for athletic people, especially if trying to build or maintain muscle. How about, here's the other part of this. How about, oh, I'm sorry, I lost it. I think
That's
it's,
okay.
It was
in-
intermittent fasting, the second
okay, how about the
question. So
benefits of intermittent fasting? Yes. Okay. So going back to the muscle mass. So we know that if people are on weight loss programs, they are often losing muscle mass unless they're eating enough protein. So can you address both for the athletic person and the person who might be on a weight loss program, how they can do this? And
Okay, so Susan, if you don't mind repeating the question, just so I make sure that I understand it clearly.
sure. So people who are on low carb diets and low animal protein diets are challenges for athletic people, especially if trying to build or maintain muscle mass. How about the benefits of intermittent fasting? So there seems to be two questions here. So however you want to handle that.
Okay, so if we look at this and from what I'm kind of extrapolating from the questions is perhaps for an athlete, can you meet your nutritional needs on a low carb, low animal protein diet? Is that what I'm hearing?
I think so.
Okay, so that's where you certainly potentially can. But again, anytime you change distribution of macronutrients, it's going to impact other areas. And so you can create a plan for you and looking at ways that we can increase maybe the types of foods that we're choosing in order to support your goals as an athlete at the same time as maintaining your lean muscle mass. So if you're choosing to do maybe a lower animal protein based diet, that's where those plant sources of protein are really going to come in. And why it sounds like it might be challenging for you is because if you're also trying to do low carbohydrate at the same time as low animal protein, it's really focusing on the types, the quality of the carbohydrates that we're choosing. So can it be done? Yes, but it does require some careful crafting and planning to help to make sure that you're getting the nutrition needs to support your athletic endeavors and also supporting your lean muscle mass. In the second half of that question, I think it was, how do you support your lean muscle mass at the same time as trying to lose weight in terms of weight loss? I think that was the question, Susan.
Well, that was my adding that in because
Oh, okay.
because I know that, but the real thing that I think you might want to address here is what is considered the proper amount of protein to build muscle mass or maintain muscle mass.
That's going to depend on the person. I wish it was a clear-cut answer. Generally speaking, though, in order to support lean muscle, at least aiming for about 21 to 28 grams of protein per meal. That is a general, very general recommendation. And protein, again, intake can be spread throughout the day from a mixture of our lean sources of protein, our nuts, our legumes, not so much of a significant source of protein, but from overall different sources of plant-based proteins. So it really depends on the person, their goals in order to help maintenance. Another thing too, not just for protecting your lean muscle mass, that's also very important, is your physical activity as far as resistance training. That can also protect lean muscle mass, especially when we're trying to create an overall calorie deficit. So it's not just looking at protein, but also what is our lifestyle looking like and how we can both support with diet and exercise to support lean muscle mass across the board. So again, it's very individual based upon a person's own individual needs, but that's a general, very basic recommendation to start out with is anywhere between 21 to 28 grams of protein, and again, can be higher or lower.
So now the other question, which was a separate question, but somehow got merged before, really
Yeah.
is how about the benefits of intermittent fasting?
So what's interesting about intermittent fasting in terms of Lp(a) is the studies were inconclusive. They didn't show any really true differences in Lp(a) levels. So in terms of intermittent fasting on Lp(a), really not enough clinical studies to show a change from what the studies that I'm seeing.
Okay. Now we have another question. Is esterified oil as bad as, hold on a second, I'm trying to get the question up.
That's okay.
As bad as, oh boy, hydrogenated oil. Is esterified oil as bad as hydrogenated oil? I see both on flour tortilla ingredient lists.
Okay, that's a good question. As far as impact on Lp(a) or cardiovascular disease in general, I'm not exactly sure. I think that the question is more so, is the interesterified worse than the hydrogenated oil? Is that kind
Or
of
as bad as, yeah.
as bad as? I'm not sure to that extent. I can get back to you on that and also include it in my updated slides as well. I don't believe so, but again, I'm not really sure what that composition looks like, so I can't really speak to that, but I can also, again, follow up on that question for you.
Okay, great. Thank you, Heather. So,
Susan, can I ask one really quick?
oh yes, please go ahead.
So, Heather, could you talk about the ketogenic diet? You mentioned it in your slides and saying that it didn't have an impact on Lp(a), but what about the harms of it increasing your LDL? So, and how harmful is that? And can, if you're taking in too much saturated fat while you're trying to be low carb, can you just address that?
Yeah, that's a great question, Jen. And I know there's so much information that's out there and different dietary patterns. And so when we look at the ketogenic diet, for those of you who are unfamiliar with that dietary pattern, is that it's usually very high fat, modest protein, if not low, and low carbs. And so there's different types of ketogenic diets as well. If we look at keto diets, they tend to be higher in saturated fat. And just looking at the beginning of my presentation, it's really looking at where those saturated fats are coming from. And if we look at an overall dietary pattern, saturated fats can increase LDL cholesterol levels and potentially other atherogenic particles. And so when we look at ketogenic diets or dietary patterns that tend to be higher in fat, particularly saturated fat, this is where we usually see an unfavorable impact on not just LDL cholesterol, but those other particles. And so that's why it's so important that we look at the overall picture of your lipid health and to understand those sources. Another thing too, when it comes to the keto diet, is also looking at the longer term studies and also outcomes, right? Because when we think about dietary patterns, overall, we want to focus on which ones are going to be sustainable, cardioprotective dietary patterns overall that are going to help to lower our risk factors. When it comes to a ketogenic dietary pattern, again, having these higher saturated fats, again, has more of those unfavorable implications. So that's where we know that replacing those polyunsaturated fats in place of saturated fat can help to reduce not only LDL cholesterol, but can also reduce our cardiovascular risks. So we have more outcome-based measures right now with what we're replacing our saturated fats with. So hopefully, Jen, that helped to answer your question.
Yes. Thanks, Heather.
So let's go to the next one on, I'm trying to get it here. Okay.
Yeah, that's okay.
Is there a guideline as to the amount of saturated fats that we should aim for each day?
So I know that, I believe that question came through in email. So I also added it into my slide. So one of the questions was, how much saturated fat should I have per day? And so looking at the studies and the guidelines, limiting saturated fat intake to between 6 to 10% of total daily calories, again, remains a good starting point. So for example, let's say it's a 2,000 calorie diet, and 7% of our total daily calories are 140. We know that 9 calories equals 1 gram of fat. And so that equates to about 16 grams of saturated fat per day. And so that is a general recommendation that we have seen that has a favorable impact on our lipid levels. And some things to keep in mind as well is, what sources of saturated fat are we choosing and what are we replacing them with? So again, incorporating those unsaturated fats. So I hope that helped to answer your question.
Thank you again, Heather. I ask about salicylic acid from food specifically because, oops, my screen is doing that thing where I can't hang on to the question.
Oh, you know what? There's one if you want, Susan.
Can
I
you read
can.
that one about salicylic? Yeah.
There was one though, I just didn't want to pass over it because it was further up near the hydrogenated oil
Oh, okay.
question. Lean chicken, turkey, lean beef, like tenderloin, and eggs. Are these okay to include in one's diet?
Yes, so I believe that came through too. So this is the last one I added. I know that was a question that came through an email. So I think this would also provide some more context. So what are some of the better protein sources? So generally speaking, incorporating plant-based sources of protein is an excellent option. Again, choosing low-fat dairy choices, and also choosing lean sources of animal-based protein. So generally speaking, the less legs it has, the leaner it is. So a cow and a pig have 4 legs, a chicken, turkey, 2 legs, and a fish has no legs. Now, in that category too, you might have leaner cuts of meat. So for example, prime rib is going to be a fattier cut of meat than, let's say, a sirloin. Okay. Also, looking at plant-based sources of protein that we can add in include legumes, which include your beans, peas, and lentils, tofu, edamame, soy milk, seitan, whole grains like your quinoa and wild rice. Again, nuts and seeds give some protein. Broccoli and spinach give a little bit as well, and nutritional yeast. So all of these sources of protein can fit. Again, choosing those leaner options that are going to be lower in trans fat and saturated fat, but also adding in those heart healthy sources of fiber and your lean protein. So hopefully this gives you a little bit of context into that question as well.
Great, Heather.
Okay.
Thank you so much for that slide. Now let me go back to the salicylic acid from foods. And this individual is asking this specifically because some studies, MESA, she thinks, showed that taking aspirin may reduce events for a subgroup of patients.
I'm not too familiar with that study as far as that if there is a link or causal relationship. I'm unsure as to if that impacts aspirin. And the question was if I'm sorry, if you can repeat the question, Susan.
Yeah, so I'll just read it again. I ask about
Okay.
salicylic acid from foods specifically because some studies, MESA, I think,
Can I mention that
showed
I'm the
that
one
take,
who,
no, please let me ask the question. We don't want to have your identity on the tape, okay? Um, because some studies, MESA, I think, showed that taking aspirin may reduce events for a subgroup of people with high Lp(a) having difficulty, and this person has difficulty taking low-dose aspirin.
Okay, I'm not sure as to the question, but what you can do also too is feel free to email me and I can also give you some context for that. I just want to make sure that I understand it correctly and can address your questions. So again, you can feel free to email me so that I can address it appropriately. So that way I understand it more completely.
Right.
So thank you for that question.
Okay, the next person asks, are egg whites versus the whole egg preferable? There's a question about eggs altogether, so about whether they're still good for you.
Okay, great
Or
question.
should, are egg whites as versus the whole egg preferable, or still do they need to be eliminated? So I think there's a couple of people that have, are questioning this.
Yeah, if you
Yes.
could address the egg question, Heather, because people want to know, are eggs good or bad? And then you hear some people that are eating 8 eggs every morning, and then, and some that don't want to touch an egg. So it would be great if you could address that.
Great question. So looking as far as egg intake, how much should we incorporate eggs as part of a cardioprotective pattern? And so when we look at eggs, most of the cholesterol is concentrated in the egg yolk along with other vitamins and minerals like B vitamins and choline. If we have elevated cholesterol levels, having one egg per day might not increase our cholesterol levels to the extent that we might have a more of an impact on our lipid levels. So basically, generally speaking, one egg per day, I would still say if you're having high cholesterol or elevated Lp(a), still be mindful of this intake. And people, again, looking at the egg yolk, again, pairing it with the egg whites, which doesn't have as much cholesterol because you're removing the yolk, can be part of an overall healthy dietary pattern. If we're consuming a lot of eggs, yes, potentially it can increase your LDL cholesterol levels. As far as eggs' impact on your Lp(a) levels, it's uncertain. So overall, I would say if you have high cholesterol, no more than one egg occasionally, maybe like 1 or 2 times a week. But if we have looking at eggs overall, again, can be part of a heart healthy eating pattern, but not too much, not more than 2 or 3. Like you said, Jen, 8 eggs per day, it's going to be excessive.
Okay, so Heather, now we have a very intricate question. What are your thoughts about Dr. Roy Taylor's hypothesis, which proposes that everyone has a limit to how much fat their liver and pancreas can tolerate before they become dysfunctional and lead to type 2 diabetes and impact with overall health, including heart health? His solution is to reduce weight, to reduce the fat in the liver and the pancreas.
Okay, so I'm thinking that if we can kind of elaborate on that question, is looking at maybe the types of fat, where it's located.
Where it's stored, right?
Right. So if we look at weight loss's effect on Lp(a), it's not going to have so much of a definitive level shift in Lp(a). However, from a cardiovascular perspective, it can potentially be impactful. So if we look at where fat is stored, sometimes, again, we have what's called subcutaneous fat. This is the fat that you can pinch, right? Then we have something called visceral fat. Visceral fat is more deeply integrated and is the type of fat that can be more metabolically dangerous, which starts to envelope the organs as far as you might have heard of fatty liver. And so what we still want to do, which can have an impact on our lipid levels, is really focus on weight loss, not just from subcutaneous fat, but from the visceral fat. So does it have a benefit? Is there a benefit to weight loss, especially of that visceral fat? Absolutely, from a cardioprotective perspective, and may have an impact on all those other lipid and lipoprotein particles that we really want to be aware of. So, and I'm not sure exactly, hopefully that helped to answer your question, whoever had asked it, but yes, where we store fat can be an implication into our lipid levels. So really working on reducing that visceral fat is what we want to focus on as well.
So we have another one here. Does saturated fat from plant options count the same as animal saturated fat?
That's a great question. So looking at the differences between your plant sources of saturated fat versus your animal sources, they might have a different impact. So if we look at my slide, I can go back to, is looking at, I'm going to go back to show you as well. If we look at your plant sources of saturated fat, such as here, we can see, yes, you're going to be getting mixed products with saturated fat, but you're also getting a lot of those monounsaturated and polyunsaturated fats. So it might not have the same effect, except when it comes to tropical oils like your coconut and palm oil, which might have more of an impact on your lipid levels. So overall speaking, and looking at your saturated fat sources, the saturated fat from your plants may not have that same impact, but we have to look at the overall dietary pattern. How is it affecting not just what we're choosing, but also what we're choosing overall from meal to meal, week to week? So overall, yes, it could still have some impact, but if we look at other things that are included, like your unsaturated fats, it might not have as much of an impact.
Thank you, Heather. So the next question is, can you talk about the ratio of omega-3s to omega-6s? Can you have too low omega-3s and too high omega-6s, even though the sources for each seem to be healthy foods?
So looking at that question, yes, there can be an imbalance. And so by looking at omega-3s and those sources, including those, the EPA and DHA, you can have a more favorable ratio that can potentially be more cardioprotective. So looking at incorporating your unsaturated fat sources, and I'll go back for you to show you that as well, in the beginning of my slide to show you those omega-3s, yes, we can have more of a favorable ratio. Another thing to note too is where are we maybe having this imbalance? If we look at our overall dietary pattern, are we incorporating maybe more foods that could be higher in omega-6s, such as our fried foods or our packaged snacks or our baked goods, right? That's something that we also have to take into effect as well, into account. So really focus on increasing the amount of omega-3 rich foods in your diet can help provide a more favorable ratio.
Okay, here's one that kind of is along a little bit more of a specific. Being a hyperabsorber and not eating any fats actually caused my numbers to get a lot worse since my body started producing cholesterol as I got zero from my diet. So now I'm being advised to start eating more seafood and olive oil to increase my cholesterol via diet. Does this sound correct to you?
So if this person, what's fascinating is, again, we have different hypo or hyper absorbers. And so this is why nutrition is so nuanced, right? Is because it's very individual based, where you can have certain circumstances where this might happen. So a suggestion would be, yes, adding in some heart healthy fat, unsaturated fats, but also monitoring as you go and talking to your healthcare team to determine what amount is right for you that you feel confident and comfortable adding back back in and that we can manage along with you. So really, it's again creating that full approach in a dietary pattern that you're going to feel comfortable with.
All right. Well, I'd like to again thank Jen for supporting this outreach program with this help of the foundation. And I want to thank Heather Shasa for doing a wonderful job tonight in presenting this topic, which is of interest to everyone. And I'm going to stop the recording here. I think we're still recording.